So we're going to shelve that because it is a cross-party campaign we've got here. So before I go into sharing with you what I've experienced in the past 2 months with the NHS, I just want us to reflect on the history of it and where it's come from and what's been done to it today. So there was a post-war consensus where your grandfathers, your grandmothers and other people, they went to war, they died, they bled, their blood is in the fields of Europe. And after that war, after so many people sacrificed their lives, there was a so-called cross-party consensus to build the NHS, to build the welfare state, to help us to develop and to move forward and build a society that, in the collective sense of things, is for the benefit of all. Now, put it this way, if you see the NHS as a house, and I do, and it's a family, and it's a massive house, I've got a house, and if somebody comes to my house and begins to steal little bits of it without asking my permission, so I suddenly open a door and the back bedroom's gone, and I think, where is that? And Virgin Care now own my back bedroom, and I've got to ask them permission to go into it. The privatisation of the NHS is tantamount to a criminal act against the working people, cross-party in this country. It's tantamount to theft. The consensus was we work hard, we pay taxes, we do as we're told, we go to work, we build the wealth of this country, we work in the public sector in the NHS and emptying the bins for the people who don't want to do those jobs themselves. The public sector workers in the NHS, they work for long hours, minimum wages. The consensus was from the cradle to the grave, work for us, generate wealth, and we'll look after you. And what have they done? A window of 40 years where the working people of this country had the opportunity to develop their education, their wealth, their houses. My parents, grandparents, my great-grandfather lived in the slums of Salford. The slums of Salford, where the average age of a man and woman to die, and I don't know what it was like down here, was between 29 and 34 years of age. Now we're living longer lives. Now, why is that? So before I go and share my story, ask yourself this question. What are you going to do as people when things are being stolen from you? If somebody steals something you own, what do you do? Who do you go to? What action do you take? Because day by day, consecutive governments and the political ideology of this country at the moment is to steal what belongs to us. I was born in the NHS, I live in the NHS, and I want to die in the NHS. Do you? So, do you live in the NHS? Yes. Would you want to die in the NHS? Yes. I was born in the NHS. What were we? And we were born in the NHS. We own it. It belongs to us, the NHS. Now, I'm going to stop before I start getting political, because I've been asked to tell the patient's story. Violins play. I'm 60 years of age, looking forward to a very healthy retirement. And suddenly, the impact of labouring for years and years in the building trade, and as a postman and as a docker, and eventually as a youth worker, I popped a couple of discs, and it hurts. So the wonderful NHS look after me, and they give me an epidural injection. And for those of you who've had babies, that hurts. I had a shock, an anaphylactic shock to this, where I nearly died. My wife thought I was having a heart attack. I ended up passing out. I woke up. I've got 3 paramedics in the room. A Scot, someone from Asia, and a Dorset lad, learning. And he sits and he looks at me. That's 3 guys. We'll go up to toting up how much that might cost in a minute, and a van outside. They look at me and he said, we're not panicking because you're not dead. That was the expertise in the room. And before I knew it, I was into the hospital, blue lighted. Everything was going wrong with me. They said, you're not dead, but we think your heart's dodgy. Your heart's okay, but we think you've got cancer. And within 3 weeks, I had gone through the whole machine of what the wonderful NHS is about. Free at the point of access, no questions asked about how long have I lived in the country, what my race is, what my nationality is, or how much I have paid. So I was born in the NHS, and I live in the NHS, and I want to die in a national health service. Do you? So, were you born in the NHS? We're gonna live in the NHS. And the very sad and poignant note is that we're all gonna die in the NHS. And before I pass it over, you die in the NHS. I'm just gonna read this statement before I go, and I could rant for hours on this. It is a crime against the working people of this country what is happening to a wonderful institution. But I'll read this, and there's a competition. You won't win anything. Who said this? Illness is neither an indulgence for which people should have to pay, nor an offence for which they should be penalised, but a misfortune, the cost of which should be shared by the community. Who said that? Yo! Right, so, what a way to end. Well, now, I was free-forming then a little bit, making it up as I go along. There's an invitation by the organisers, who I'd like to thank before I move on. The main organisations of the Keep Our National NHS, whatever it is, public. I'd personally like to thank Terry Stewart, wonderfully organising stuff, Colin Tollovey, the People's Assembly, and Damien Stone. Without their really hard work, overcoming barriers, and there are barriers out there for us unifying around this common cause, massive, and they have done a fantastic job. There is now an invitation. Is any of you moved to come up here and tell us your story? Tell us something that you have experienced, or would you like to get up and rant about what's happening? Is there anybody out there? Is there anybody coming? Round of applause, please.